Hello everyone. Welcome to health industry. And the topic of today is gonna be being a doctor. Well, I don't know shit about what being a doctor is like, but what I know is what being an intern at a private college is like in India. I myself am an intern currently working in UP. I'm not gonna disclose my exact location or my medical college because I don't feel comfortable doing that. So let's get into it. Communication skill practice 101. So internship, it is a positively thrilling experience, trust me. This is the first time we are earning a stipend. It's not much, very less in amount, but it's still 1,000% improvement over earning zero. Not just earning zero, but bleeding money. So we are no longer bleeding money and we are making it. So hooray, 3 cheers for us, and it's amazing experience. Now next up on the agenda is gonna be, what is it like? I'm gonna ask myself, what is it like, Dr. Hitoshi Daya, to graduate from being a medical student to being an intern? You see, it's weird. All of a sudden, we are authorized to do things that we weren't authorized to do before. We were just students, studying, observing, just listening to teachers, writing down the subjects, extensive subjects, no doubt, but students nonetheless. And even though with all our in-depth knowledge, our good skills, our clinical sense being developed over the 5 years, it's still an altogether new experience to interact with patients, to have them come up to you with all sort of bizarre nonsense, right? Sometimes patients are just ridiculous. Sometimes they are very sensitive. Sometimes it is just pure comedy gold. Sometimes you have tears in your eyes seeing the condition of a patient. Okay, so I'm gonna just talk about one of the few experiences I had, one of the good ones. So let's say there was one patient with a diabetic foot gangrene. Now, what was wrong with this patient? Let me elaborate for the non-medical friends to make it easy to understand. So what was wrong with this? That when a person has chronic diabetes, that is sugar. So where was I? Yes, I was talking about the issue. I was talking about some of my clinical experiences that were fascinating and amazing. So one of those was a patient of diabetic foot. Also she had foot gangrene. So for the non-clinical guys who do not understand these terms, I'm going to explain it in very simple terms. So you see, a person who has chronic diabetes, that is someone who has the sugar problem for a long time, often develops vasculitis. So there is inflammation in their blood vessels, which causes decreased tissue perfusion in the peripheral distal areas like foot, hand, etc. So due to the decreased blood supply, and as a diabetes, there is often increased blood glucose level in general, causes it to become easily infective. So on top of being poor immune power, and I'm trying to explain in simpler terms, because on top of being poorly vascularized, these distal areas become easily infective. That is known as a diabetic foot, which causes gangrene. Gangrene is a medical term in which the gangrenous tissue becomes completely necrotized. it may be infective or may not be infective. In this case, it was infective. So there was a lot of pus and discharge at the area. So, and she was a old lady, around, I don't know, 65 years of age. And I suppose the procedure done by our ma'am was a very simple procedure. It was just regular dressing and debridement of the necrotic area, gangrenous foot. Then the dressing was very painful, I assure you. It is nothing fun to look at. She had this deep ulcers in her foot, around very big ulcers. Her entire foot was disfigured. Gangrene is a condition in which there can be non-healing ulcers, and it can progress to require amputations, right? If the nerves are dead, the vascular supply is impaired completely, then it will require amputation. But in this case, the foot could have been saved. So what we were doing was debridement. Debridement is to prevent further infection. We clean it with NS, normal saline, and then we clean it with antibiotic solutions and creams. For example, povidone, that is iodine and alcohol. So the cleaning was, I can assure you, if you have this deep ulcers, this big ulcers in your foot, various, and someone takes gauze piece and dips it in spirit, thing that makes your wound gel feel very, very painful and burning sensation, then it is damn near painful. The old lady, the 65-year-old, she had no attendant with her. There was no one with her. She was lying alone on the bed, and our ma'am was just scrubbing her ulcers as was required under the constant application of normal saline and antibiotics. So while the debridement was being done, the lady was in horrible pain. She had her jaw clenched, the sheets tightly gripped in her arms, and just horrible painful sensation for the lady. But what was even more painful was what came after for me. What was more painful was after the debridement was done, I just, for practice sake, was looking at her reports. I sat down next to her and wanted to talk to her a little bit. And what I found out, I saw that her HbA1c report was high, sky high, around 11%. Her random blood sugar was around 290, 300. So it was a clear-cut case for me, but I just asked the patient out of concern, do you need anything? Do you want to know anything about your condition? Because it is a doctor's role to communicate effectively with the patient. But the old lady was just waiting to vent it out. Okay, the old lady started crying profusely. She told me all about her story. Her daughter-in-law does not support her. Her son no longer listens to her, but listens to his daughter-in-law, and they are not even inclined to pay for her treatment. There is no attendant. She's just left alone on her own. She claimed that her foot could have been saved if she got adequate treatment, but she kept on asking that get me to hospital. But she could not walk on her own, and her son and daughter-in-law just did not support her. And she did have some land to her name, which was passed down to her, but unfortunately her sons and daughters kinda just don't give a shit. So believe me, if you are an old guy who has no money, nobody can help you. I wish I could have helped her, but I just don't have the money or the capabilities to do anything in this juncture. She just kept asking me to somehow make her stay in the hospital because she didn't want to go home. She hated everyone in her home. She cried in front of me for 10 to 15 minutes. I tried my best to give her a listening ear, because that's all I could do at that point. Then I get a call from my senior and I had to go. So another good experience I got while in internship was, I guess, recently I saw a case of liver abscess and a hydrocele case I saw recently. Cholelithiasis and renal stone we see all the time. I saw a renal stone. I have memorized the prescription. I'm pretty sure, aside from the surgery itself, I can process a patient of renal stone completely on my own. I'm just that good, baby. So I guess let's just end the video for today, because I have to go and get my attendance done. And there's also lunchtime. I just don't feel hungry. I don't know why. What's wrong with me? It's been a fun couple of days. It's just my health could do better at the moment. God be willing, we're gonna save a lot of people and we're gonna look good doing it. Health industry, peace out.